Welcome to Long-Term Care Policy and Management. This is Public Health 627. This is your Week 6 video. Week 6 looks at home care services and the home care industry. We talk about the types of home care, the services that are covered by insurances, regulations, and the costs. This week really covers all of non-institutionalized services. So community-based services are really for all those folks living out at their home. This can be a whole host of things. They can include ADLs, laundry, medication management, more clinical assistance, hospice services, adult daycare. So those non-institutional services are really broad. Usually, home care is much less expensive than institutional care. And there's a caveat here in that sometimes home care is actually delivered to a person in a facility. And I know that sounds confusing, but if a person is in a assisted living facility and it's considered their home and they qualify for home care services, then they would actually get home care services. In a nursing home, usually it's a little bit different because there's services on site, so it might not qualify as home care. But some of those residential care assisted living facilities that don't have the whole spectrum of care on site would access home care services. So just know that there is an exception to that rule, as usual. Home health versus home care. So the book talks about how these two terms are used interchangeably, but they're actually different. And so this is one of those things where you can go to one state and it's one way, and in a different state it's a different way. Generally, home health is usually more clinical. Home health usually is covering those services that are connected back to a doctor who has either prescribed them or suggested them. Home care is really more ADL related, and a lot of times home care could be things like helping with grocery shopping or setting up medications in a pill box. Maybe not so clinical. Although in your own area, maybe they mean the opposite. So home health and home care, just be careful of how you use those terms. There's other terms that can be used interchangeably. The home health aides, these are not RNs or CNAs. These are the folks that come into homes to do ADL-related activities or grocery shopping or setting up medications. Some states call them home health aides or a personal care attendant or a home health attendant. So those terms can be used pretty interchangeably across the U.S. So the major home health model that most people recognize is hospice. Hospice can be provided really at home or in a facility. A lot of times it is provided in a facility. This is a type of care to focus on the quality of life. It's not meant to fix underlying health issues. It's really meant to keep health consumers comfortable towards the end of their life. Usually this is set off by a doctor saying that a patient probably has 6 months or less to live, and then they would qualify for hospice. So hospice is really the most notorious of the home healthcare models. The book also talks about adult daycare. Some areas have adult daycare pretty prevalent. Some areas you're not going to find it. You might find a whole half a state without an adult daycare. Some models are really similar to children's daycare. It's really created to allow individuals to stay home and be out during those working hours of the day when family members who would normally care for someone are working. It allows them to be social with others, be away from the home safely, and have interactions. So a typical adult daycare might be from 8 to 5 or 9 to 6 during the day, and someone would drop off the consumer just like they would a children's daycare and pick them up in the evening. So who pays? Medicare pays the majority of home health. A lot of that goes through hospice. Medicaid also pays for a lot of home health. And a lot of that is home care with ADLs at home. So those activities of daily living that we've discussed, bathing, dressing, toileting, mobility, grocery shopping, and medication management. A lot of that is ADLs that could be paid for by Medicaid if a person qualifies for Medicaid. A lot of states will pay for home care if the consumer qualifies to be in a nursing home. And that is because care at home is less expensive than care in a nursing home. So a lot of states will pay for that. The federal government requires that Medicaid pay for some home care, and you can see those in the book, I believe. But like many things, state to state, they can make different rules about what they really want to cover and not cover. Private insurance will cover home care, but as with other things, those long-term care insurances are very different, and sometimes they don't want to cover specific services as much as just cover reimbursement. And then private pay is really a big chunk of this market, and that's consumers or their families paying for someone to come into the home for multiple hours a week. How much does it cost? It really matters who comes to the door. RNs, registered nurses, are going to make more than CNAs. CNAs are going to make more than PCAs or HHAs. The average ADL home care assistant is probably going to cost $25 to $75 an hour. So somebody who needs 12 hours a day of care, that's pretty expensive. So if you think of the average nursing home being $300 a day, that's about, 12 hours of home care at $25 an hour. So you can see how a nursing home is actually quite a bit more expensive per day than getting one-on-one care. But then there's also the other people that might need to come in: therapists, OTs, PTs, speech therapists, other people that might need to come in: translators, counselors, social workers. So that's just the basic home care assistant cost. There are other costs to home care. So the balance, more consumers identify that they want to be home than at a facility. That's pretty straight across the board. Many studies are showing that staying home is a lot less expensive than going to a facility. So the question really to think about this week is, why aren't we focusing on home care? Why don't we just do home care? Well, it's not that easy. Home care is usually preferable, but this is a very difficult job for people to come in and out of the house every day. Home care providers are really not paid well. A lot of them make minimum wage across the country. They're usually not full-time workers. They're usually part-time or per diem workers, so they don't hold benefits like they would at another job. Because of that, there's really low retention, so people don't stay in the jobs very long. It can be a physically difficult job. It can be an emotionally draining job. So it's a workforce that goes through a lot of flux a lot of the time. So even though home care might be obviously preferable as a model, there are some drawbacks and reasons why that doesn't automatically happen. So you do have an article to read that gives you an interesting viewpoint about home care, along with Chapter 8 this week. And as always, I'm here for your questions.